We're going to shift into a thoracic mode for the rest of the day. So I don't have any relevant disclosures for this or actually any of the other talks. I do have a disclosure which I think is listed somewhere, but it's not relevant for this. So thoracic infections is a real issue that one runs into in the ED and overnight situations, and can be very confounding because, a lot of times we just say, hey, it's an infection or maybe an infection of some sort. And pneumonia is very common. It's the 8th most common cause of death in the United States. Large number of patients in immunocompetent patients, and a lot of it requires hospitalization. As I note here, nosocomial pneumonia is the most common infectious cause of death in hospitals. And generally, we're going to look at this with chest radiography, and a lot of it is just following it. And CT is reserved for a second line as a rule to see if there are complications or to better characterize it. And so what I was going to do is talk a little bit about some general presentations, and I've listed some different presentations we can have. And then the other point, though, I want to make is that there are times we can be a little more specific. I mean, infectious disease will come down and say, what is this pneumonia? And you sort of laugh and say, CBFA. I won't tell you what that stands for, but that could be something. Anyhow, so, but sometimes we actually can tell them something, and so I'm hoping here to give you a sense of when that might be the case. All right, so let's just briefly go through some of the patterns, and from there we can talk a little bit about some of the specifics. So lobar pneumonia, of course, everybody knows that is defined by its distribution. It's often community acquired, frequently outpatient, particularly if the patient doesn't come immediately to the emergency room. It often isn't, in fact, fully lobar. It's a little less than lobar. There are some classic descriptions. So there's this description, if you go back to before my residency even, where Klebsiella was said to have bulging fissures. It was also called Freelander's pneumonia in those days, which is no longer, nobody knows that term. And classic strep pneumonia, if it's not caught, has a lobar pattern as well. And then other rare pneumonias can be lobar as well. So lobar pneumonia is not something, and there's a nice example on the radiograph showing you that. And this is actually a case of bulging fissure pneumonia, which I think may have been Klebsiella. Here it is on CT.